I want to welcome folks back to our fourth interview in this series that we're doing in preparation for the Maine town meeting, which will take place on June 1st. The speaker will be Dr. Jonathan Rubin, who's the director of the Margaret Chase Smith Policy Center. And we've been speaking to staff members at the Policy Center. And today we have Jamie Wren. Good morning, Jamie. How are you?
I'm very well, David. How are you?
Very well as well. And thank you for taking the time to speak with me. So the first question I always like to ask is, how long have you worked at the Margaret Chase Smith Policy Center?
So I actually have a sort of unique and interesting journey to finding myself at the Policy Center. I have actually been at the Margaret Chase Smith Center since 2010. It was June of 2010. I started working for Dr. Marcy Sorg, who's a research professor here, as an undergraduate student research assistant. And I worked for Marcy as an undergrad assistant all through my junior and senior years at UMaine. And then when I was graduating from UMaine, I told her that I really wanted to go get a PhD in anthropology. And she said, great, I think that's a fabulous idea. Or you could get something that'll give you a guaranteed job. And so she twisted my arm and convinced me to get a master's in public health. And so while I was getting my master's in public health, I continued to work for Marcy as a graduate assistant. And then when I finished, a grant opportunity came up that was too good for us to pass up. And so I started as a research associate full-time in September of 2015. So I've had a long road to being a full-time staff member, but I've been involved one way or the other with the Policy Center since 2010.
That makes you a pretty senior member of the Policy Center. You have quite a bit of seniority there.
So there's very few people left on the staff who have more seniority, than I do. But I've been around for a while. And interestingly, sorry, you didn't ask this question, but tangent. Margaret Chase Smith has been sort of central to my UMaine experience from the get-go, because when I took English composition, English 101, my fall of my freshman year, the topic was McCarthyism. And so Margaret Chase Smith was introduced to me my very first semester at UMaine. And so she's sort of been a part of my whole career since the fall of 2008. Very
interesting. So another question I'd like to ask at the outset, and I think you may have already addressed it, but I don't know if there's more you want to add. Why you wanted to work at the Margaret Chase Smith Policy Center? Was it about this grant opportunity coming along?
So initially, I started working, I met Marcy Sorg, who's a research professor here, through her appointment with the anthropology department, because I was an anthropology undergrad. And Marcy has done the surveillance of drug overdose deaths in the state since 2002. And so I was fascinated by that research topic and all of the things that Marcy has her hands in. And so I started working with her then just because I was fascinated by the topic. And the grant opportunity that came along in 2014, 2015 was an equally fascinating topic, which is the Maine violent death reporting system, which captures which does surveillance of all of the violent deaths in Maine. So homicides, suicides, deaths of undetermined intent.
And you may have already just slid into the next question I ask, is that what projects are you working on?
Certainly, I am the project director for Maine's violent death reporting system, as well as Maine's sudden unintentional drug overdose reporting system. And what those projects do is collect in-depth, circumstantial, and very detailed information about death events related to homicide, suicides, deaths of undetermined intent, and fatal drug overdoses. And that data is collected through the medical examiner, the Office of the Chief Medical Examiner in Maine, as well as through law enforcement records. And there's something like 634 variables that we collect.
Wow.
Everything from the basic victim demographics of age, sex, where they lived, to how they died, to what was happening in their lives. Were they experiencing a chronic pain issue? Were they experiencing intimate partner violence? job insecurity, housing insecurity, things like that. And we use all that data to get a better picture of who is dying and why they're dying in Maine. And we're able to give that to prevention folks that we work with from Maine CDC, Maine Office of Behavioral Health, and of course, federal CDC, who is our funder. And they're able to use that data to create evidence-based prevention measures for those types of deaths.
Mm-hmm. How far back does your data go? Is it to 2015?
For the violent death data, we started doing that. The first year of data collection was 2015. And for the drug deaths, Marcy has started collecting the drug deaths going back to 1997, but the in-depth surveillance we started doing in, it goes back to January of 2016.
Mm-hmm. And do you discern trends, or are you just about collecting data?
They come in so fast that a lot of times it's very easy to just have your blinders on and put your head down and get the work done.
Mm-hmm.
So it's always sort of a treat, maybe treat's the wrong word, but to come up for air, so to speak, and be able to look at the data and see what's really happening in the state. So we've grown quite a bit in the past couple of years. So when I started working for Marcy in 2010, it was she and I.
Mm-hmm.
And when I became full-time in 2015, it was she and I. And now we have approximately 21 people working for us on different grants, and everything from, like, you've spoken with Dan Soucy and Alex Resk about the Maine naloxone distribution initiative and the Maine Drug Data Hub. Those are all expansion projects that we've been doing in the past couple of years. And so we've grown quite a bit, and now we have a nice data team. So we have folks who collect the data and folks who analyze the data. So it's nice to be able to have the resources to dig in and look more at that trend data.
And just to remind people, they're either watching this on Facebook or on our YouTube channel. And if you missed the interviews with Dan Soucy or Alex Resk, you can watch them on either of those two platforms. And Dan is in charge of the Data Hub.
Correct.
And Alex helps administer the naloxone distribution for the state of Maine. And that they are some of the, what'd you say, 20 some odd members of the team?
20 to 21. It fluctuates a little bit with students coming and going, because we have several student employees, both undergraduate and graduate. So students can be sort of seasonal during the academic year and phase out in the summer and phase back in the fall. So it fluctuates, but I think right now we have somewhere between 21 and 25. The specific number, you'd have to give me a second to pin down.
When we first started doing this series of interviews, which goes all the way back to May of 2020, we're doing them because of the pandemic. People weren't able to come to the library, so we're trying to get content to put out for people to be able to view. And so we were quite focused on this idea of the pandemic and how it was affecting people's life and work. Can you see ways in which the pandemic has very much affected the types of research you're doing, these issues of violent deaths and drug overdoses? Do you see a direct linkage between the pandemic and some of the trends?
Yes and no. There's been, for violent deaths, they actually went down in 2020. I don't know quite why we just closed out the 2020 data year a week and a half ago. So we're still digging into the final data set to see, who maybe is missing from the data or what the circumstances were for those deaths. But it likely had to do more with people being home and in proximity to others, and maybe had greater supports and things like that. And then for the drug overdoses in Maine have increased substantially over the past several years from 2019. From 2019 to 2020, I think there was a 30% increase. And then from 20 to 21, I believe we're projecting like a 26 or so% increase. And so people thought, oh, well, the COVID-19 pandemic fueled drug overdoses, but drug overdoses actually started increasing in late 2019, and the trends have continued. We're actually just digging in right now to the drug overdose data to see what the demographics and the characteristics of those who are dying from drugs look like, because I do think that has changed. I think that landscape has changed a little bit.
Mhm. And can you go over again what constitutes violent deaths? Homicides, suicides, is there any?
Yes, and then what we call deaths of undetermined intent. So
Okay.
these are deaths where the medical examiner's office was unable to determine
Mhm.
whether it was an accident, homicide, suicide, or natural death. And so undetermined deaths are really when there's equal evidence for several different manners. So, it might be someone with a head injury, and we don't know if they tripped and fall, if it was an accident, or it may have been foul play.
Did he fall or was he pushed?
Correct.
Yeah.
Correct. So those types of deaths. And we capture those specifically to hopefully the goal is to get enough data from those undetermined deaths to maybe help medical examiners make more informed decisions when they're looking at characteristics of those events.
So what is the order of magnitude of violent deaths in Maine? My recollection is usually roughly around 24 homicides a year in Maine. So overall, what's the number of violent deaths?
So there's about 300 to 320 violent deaths a year in Maine. Those are all cause, all manners. And your recollection is right. The number fluctuates around like 18 to 25 homicides a year, which is fairly low homicide rate for a million people, for 1.3 million people. We do have a slightly higher suicide rate than the national average. And we somewhere between 280 and 300 suicides a year in Maine, going back to 2015 is what we see.
Is it difficult investigating tragic, violent deaths? How do you maintain your sanity?
That is an excellent question. Some could argue that I don't. I think that we have a very tight-knit group of folks working on this data, and we've developed a really nice support system within our group for each other. Like, this case is really bothering me. Can we just talk it out? Or, you know what, I really don't like this case. Could someone else please step in and finish it for me? So whenever anyone new starts working with us, I tell them, if we get 2 months in and you don't feel comfortable with this, no sweat, it's not for you. Reading descriptions and seeing visualizations of violent death is not for everyone. So I think it's really important that we sort of rely on each other, but then I always encourage folks to have some strong self-care routine, whether it's exercise or their family or pets or getting outdoors. When we were in the office, a lot of us work remotely now who work on these projects. But when we were in the office and it was nice out, we would frequently say, okay, 2 o'clock's rolled around, let's go for a 20-minute walk as a group, or let's take 20 minutes and work on the, puzzle that we always have going on in the lounge. That was pre-pandemic. So post-pandemic and, well, in the pandemic.
It's pandemic.
We all try to do lunch together once a week. Just so that we can see each other and not talk about something other than work. But it is very, very, let me say, another very important piece of this work is to have good intellectual boundaries and good work-life balance. I encourage people to, use their vacation time, to use their sick time if they need it, to really maintain as much of a balance as they possibly can.
Do you do field work, or are these reports that are being submitted to you for then to analyze what's behind these violent deaths?
That is a very good question, and something I wanted to point out about these deaths is these are reports that are submitted to us. Well, not to us, but to the Office of the Chief Medical Examiner that we're then given access to. And we don't have any authority whatsoever to be like, oh, geez, I have a question about what this family member said to law enforcement. We don't have the authority to go either reach out to the law enforcement officer or to reach out to the family member. So we really are only able to collect what is reported. And thankfully, Maine has excellent and very high quality law enforcement and an excellent medical examiner system. So the data that we collect is very high quality. But for example, if someone was seeing a therapist and their family didn't know anything about it, we wouldn't know anything about it. So we can only really collect minimum counts of these circumstances that go on in these deaths in Maine.
You work for a policy center. What do you see the role of the policy center being as it pertains to the work that you're doing?
We are a data warehouse. Our specialty is data collection and data analysis.
I've heard lots of discussion of the term data hub by people,
Yes.
and more than just Dan. Megan was talking about it as well.
Yes, and I think it's very important that we serve as a data repository for folks because, as I'm sure Jonathan will go into, the Margaret Chase Smith Center is a nonpartisan, non-advocacy, data-driven organization. And so it's nice to be able to have these policymakers who are asking questions about, well, is XYZ a good policy? And we're able to take them the data that shows either, yes, it's effective, or no, it doesn't seem to have an impact, so that resource allocation can be appropriately managed. And it's nice that we're able to provide that service to the state.
And you used the term earlier, so that evidence-based solutions can be devised. As you're researching these areas and thinking about some of the underlying problems, do you ever have a light bulb go on in your head and say, gee, we should do this to address this issue?
Oh, certainly. And, as you are reviewing cases and making sure that everything is, doing through the quality control process, you might read, 300 narratives of violent death in a week or something like that. And so that intensive dive, you suddenly start to see patterns emerge like, oh, these individuals recently were unable to find mental health treatment in their community. Maybe telehealth is a way to go. Or, gee, these individuals were unable to access a treatment facility, whether it be for substance abuse or substance misuse or mental health treatment. And what are the barriers that were in their way? Was it transportation? Was it financial? Was it stigma? And so you start to see those patterns emerge and just make little notes. And I serve on the Maine Suicide Prevention Advisory Council, which helps oversee the suicide prevention program for Maine CDC. And so in that forum, I'm able to share the data with them and sort of hopefully hope that someone might take up the mantle and run with it.
I don't know if you saw 60 Minutes this week, but one of the segments was about teenage depression, suicide, and how those rates have been going way up apparently during the pandemic. Are you seeing signs of that at all? Or that this issue of suicide at a much younger age?
I have to say, thankfully, we are not. We definitely have seen some that are directly related to the pandemic, whether that be folks experiencing financial problems because of the pandemic, or job problems because of the pandemic. We've seen a couple of those, but thankfully we have not seen a substantial increase in youth suicide in Maine. We're very fortunate in that respect.
So one of the things that's been interesting to me in the course of doing these interviews is to hear the extent to which each individual's disciplinary background really informs the way they look at these issues. So Dan with history, Alex with anthropology, and Megan with economics. You talked about starting out wanting to be an anthropologist, and you've sort of picked up an added discipline of public health. Can you talk about the way your disciplinary background informs the way that you approach your work?
Certainly. They go hand in hand, so it's almost not something like I think about on a daily basis. But after I got my MPH, my master's in public health, I ended up enrolling in an interdisciplinary PhD program in anthropology here at UMaine. So I'm back to doing anthropology.
Mm-hmm.
But with public health, it was it's a professional master's degree. And so you learn a lot of, things like social determinants of health, like what goes into barriers, structural, systematic barriers. You learn, epidemiology and how to count the burden of disease and things like that. And so when it came time to do the Violent Death Grant in 2015 or 2014, it was funded. It was a very natural segue into this, because it's such a public health problem, and you really learn to focus on, the not just counting it, but helping to figure out the why and how. It just gives you a little different framework and a little different exposure to things. And one of the best courses that I took in my master's program, besides the things that helped me quantitatively, like epidemiology and things like that, was a course on health literacy. Mm-hmm. And how individuals' knowledge and literacy levels can impact their interactions with healthcare systems and the medical system in the US in general, and really getting appreciation for, not everyone has the privileged understanding of maybe speaking English as a first language, or being able to read English fluently. And that can be a huge barrier to getting access to treatment for mental health or substance use.
Another striking thing to me is the intellectual curiosity that you all have, and that you need to have it fed. And Dan already has his PhD, but the other three of you are working on your PhDs.
Yes.
So where are you in your PhD program?
I like to say I'm ABCD. Okay. So I'm all done my coursework, and I've done all but my comprehensive exams and the dissertation. Okay. So hence the ABCD. I'm actually working on my dissertation right now, doing data collection. And for my dissertation, I'm looking at the effect of chronic alcohol use on the human skeleton, specifically the cranium and the head, looking at the bone quality and bone density of the human skull in long-term alcohol users. And
your hypothesis is, or do you have a hypothesis at this point?
So there's a very well-established link between chronic heavy alcohol use and osteoporosis. Okay. But frequently it's been examined in the clinically important sites of like the wrist, the hip, the spine, things like that, where there could be a high burden of injury. But we frequently see in the medical examiner data, individuals that may be inebriated and fall down and have a head injury and die of their head injury.
Mhm.
And my hypothesis is that the bone quality and so therefore the protective effects of the human skull are lessened as they would be in the hip, wrist, or spine. And so fingers crossed that's what I find. But I'm using a really unique data set from the Office of the Medical Investigator in New Mexico. They received a grant in like 2007 to do head-to-toe, very fine-grained CT scans of all the patients come in. So they have something like 17,000 individuals CAT scans. And so I am looking at CT scan images of heads to help me solve this puzzle.
Okay, so let's take this in order. Let's go back to the C. When do you hope to have your comprehensive exam completed?
Oh, this is a really good question that Marcy would love. Because Marcy Sorg is my advisor. For those who don't know or aren't familiar with Marcy's work, aside from being the substance use disorder and mortality guru of the state of Maine, Marcy is also the state's forensic anthropologist. So she handles all of the cases that come into the medical examiner's office that are significantly decomposed or typically fully skeletal. And I've been assisting her with those cases for over a decade now. So hence the sort of seemingly left turn that I take for my dissertation, but it's all related. But Marcy is my advisor, and I'm hoping to do my comprehensive exams either late summer or early fall of this year. We'll have to see what my committee schedule is and what my go-gettedness is. And then if I can complete that, then I hope to have my dissertation done next May.
Excellent. A year away. You'll be Dr. Wren within a year.
That would be nice. But
you'll be marching in next year's graduation.
I'll meet myself where I'm at when it comes to
very good.
Yes, Marcy is very anxious for me and Alex, because she's Alex's co-advisor, to get done.
And your exams, both oral and written?
Yes, oral and written.
And how, 3-person committee?
I actually have a 6-person committee.
All right.
So it's a little large, but I have Marcy and one other board certified forensic anthropologist. Dr. Mark Flomenbaum, who is our chief medical examiner, is on my committee. And then I have someone from nursing and someone from kinesiology, biomechanics, and then someone from the University of New England who has an affiliation with the Graduate School of Biomedical Sciences, who's a specialist in osteoporosis.
How many projects would you say you're working on at any one time?
The mortality surveillance are my 2 main ones, but I think I have my hands in at least 6 projects right now. Because we take money where we can get it and where we know we can do a good job. Because myself, like a lot of folks at the Policy Center, are what's called soft money funded. So we exist on grants that we bring into the Policy Center. And so we sort of cobble together our jobs where the funding lies. But aside from doing overseeing and directing the mortality surveillance, I also do all of our project admin and budgeting. So for the data hub for the naloxone distribution initiative, I handle the contracts with the state and the budgets with the state, and work with Michael Scott, who's our admin and fiscal manager, to coordinate invoicing and purchasing and the budget justifications and budgeting for future years and
Mhm.
all that fun higher level admin stuff that makes you go cross-eyed when you think about it too long.
Well, very good. I want to thank you for talking about your work at the Policy Center, and I want to wish you well with your personal goals of getting your PhD. Hopefully that will come to fruition within the next year. And I want to remind people again that we're doing these interviews as a lead in to the Maine Town meeting on June 1st, where the director of the Policy Center, Dr. Jonathan Rubin, will be our speaker. And I will put a link to how you can register into where this Facebook post is. And hopefully people will come and learn more about the Policy Center, the overall work that it does, and how it came to be connected to Margaret Chase Smith. So I thank you very much, Jamie, and I wish you well.
Thank you very much, David. I appreciate your time.
All right.
Take care.